The term butterfly needle is also called a winged needle that has a distinct shape. Let's take a look at this unique tool for phlebotomy. Let's take a look at the unique look of a butterfly needle. There are two needles, one of which is for the patient's arm, and one that is screwed into the plastic hub. It contains some plastic tubing between the two needles that is between 2 and 15 inches long. It also contains two wings next to the needle. One side will be smooth, and the other will have some texture associated with it. The textured side will face the patient's arm and be used for gripping and stabilization of the butterfly needle. Butterfly needles also tend to be a larger gauge from 21 to 25, which if you remember means that it is a smaller sized needle. This needle may be used on patients with more fragile veins, such as elderly patients or on small children. This may be a good choice for veins that are smaller, such as the veins of the hands. As this is a smaller sized needle, this may lead to more patient comfort when completing a venipuncture procedure. The steps of performing a venipuncture are the same if you are using a two-sided straight needle or a butterfly needle, but you may choose the butterfly needle for the patient. This should not be the default choice, as the more narrow needle size may lead to hemolysis of the blood sample and the need to complete the procedure over again.